When we think of Parkinson's disease, we often picture the classic signs: a hand that trembles, a stiff walk, maybe a hunched posture. But here's something few people realize. That's not how it begins. Today, I want to tell you the real story of Parkinson's. It's not a story that starts with a tremor. It actually starts quietly, with a gut that won't cooperate, a nose that can't smell coffee, strange dreams, and other symptoms that don't seem to be directly related to Parkinson's in real time, but become meaningful retrospectively. And in this video, I'll walk you through the latest research. The description is below, and early warning signs, some of which can show up 10 or even 20 years before a diagnosis. And we'll explore a powerful connection between our gut and the brain that may be changing how we understand this disease altogether. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. First, what is Parkinson's disease? As many of you know, Parkinson's disease is a progressive neurological disorder. And at its core, it damages dopamine-producing cells deep in the brain, specifically in a region called the substantia nigra. Why is dopamine important? Well, dopamine is like this brain's traffic light. It helps control movement, motivation, and even our mood. And when those neurons start dying, the signs begin to show: slow, rigid movements, tremors, and balance problems. But here's the catch. By the time those symptoms show up, nearly half of those dopamine neurons are already gone. The damage is well underway, possibly for years. So the question becomes, can we see it coming? And even more importantly, can we do something about it? Can we do something earlier? So let me take you back to where the story may actually begin. And it's not in the brain, but in the gut. So recent studies have revealed that a protein called alpha-synuclein, which normally helps nerve cell function, can actually start to misfold and clump together. And these clumps are called Lewy bodies, and they're one of the defining features of Parkinson's disease. But Lewy bodies don't form just in the brain. They can first show up in the enteric, or otherwise called the gut nervous system. And that is, I find that actually truly amazing. And from there, researchers believe that these misfolded proteins may travel up the vagus nerve like this slow-moving courier, reaching areas of the brain that control smell, mood, and eventually movement. In functional medicine, we've long believed in the gut-brain axis, and that is essentially a two-way street of communication between your digestive tract and your brain. And now we're seeing just how powerful and dangerous that connection may be. Constipation, leaky gut, microbiome imbalances, inflammation, even long-term exposure to toxins like pesticides, these may all play a role in setting the stage for Parkinson's. And this is why gut health isn't just about digestion, as I always tell my patients. It's foundational to lots of things, including brain health. So let's delve into these early signs of Parkinson's now. So one of the strangest earliest signs is REM sleep behavior disorder, or RBD. Normally, your body is paralyzed during REM sleep, so you don't act out your dreams. But in RBD, that safety switch fails. People may punch, kink, shout, or even fall out of bed during dreams, and often have no memory of it. And here's the remarkable part. Studies show that 80% of people with RBD will develop a neurodegenerative condition like Parkinson's or related condition called Lewy body dementia within 10 to 15 years. It's one of the clearest red flags we have, but because it seems quirky or unrelated, it often goes unreported. So if this is happening to you or your partner, it's worth talking to a doctor. Next up, your gut speaks. Constipation might not seem like a big deal, but in Parkinson's, it can be one of the first signs. The same misfolded proteins alpha-synuclein proteins that form Lewy bodies in the brain. So these same proteins, they have been found in the intestinal nerves of people years before diagnosis. And this helps explain why up to 75% of people with Parkinson's suffer from constipation, sometimes for decades beforehand. From a functional medicine lens, this makes us think about why the gut is slowing down. Is it inflammation, nerve damage, toxin exposure that's directly affecting this and then leading to all other things? All of these factors may be a part of the bigger picture. We really don't know. Next, we have loss of smell. If you stop noticing the smell of coffee or your favorite perfume, that could be a sign. Hyposmia is a name for reduced sense of smell, and it's one of the earliest clues. And again, it ties back to those Lewy bodies. Alpha-synuclein tends to build up in the olfactory bulb, the brain region responsible for smell. And this symptom may appear 10 years or more before any motor changes. It is subtle, but when combined with other clues like sleep issues or gut problems, it becomes more meaningful. Parkinson doesn't just affect movement. Of course, it touches the mood. Depression and anxiety and apathy can show up long before the tremor, and these symptoms are often misdiagnosed as standalone mental health issues, but they may reflect early dopamine and serotonin changes in the brain. In fact, many people with Parkinson's look back and realize that their emotional struggles started years before any physical signs. So if you or someone you know is struggling with depression and also has some of the signs we just discussed, I think that it's worth discussing with your doctor. So let's look at other early clues. I'm going to list them. Micrographia. So one day your handwriting is neat and the next it's small and cramped. And that is what micrographia is. Literally, it is a small, cramped handwriting. And this early motor sign reflects subtle changes in fine muscle control. Next up is hypomimia. So that blank look or serious face, it's not a mood. It is reduced facial muscle movement. Then we have, of course, fatigue. Fatigue is very vague. So it could be like deep tiredness that is not helped by sleep. And it's common in early stages. It's very hard to pinpoint or diagnose because it is so vague. The next one is reduced arm swing. So one arm stops swinging naturally while walking. It's so subtle, many people don't notice it until someone points it out. So eventually, the symptoms become harder to ignore. And we call them the trap signs. T for tremor at rest. R for rigidity in the muscles. A for akinesia or bradykinesia, slowness or freezing of movement. P is for postural instability, difficulty with balance, especially when turning. These are the symptoms that typically lead to diagnosis. But by this point, the disease is already well established. That brings us to the core question. When should we be concerned? So one symptom alone doesn't confirm Parkinson's. But if there's several early signs that are present, like, for example, from what we listed, acting out dreams, constipation, loss of smell, mood changes, and also family history of Parkinson's, then it's time to talk to a neurologist, ideally one who specializes in movement disorders. They may recommend a test like DAT scan. It's a type of scan to diagnose Parkinson's and related movement conditions. Other studies that are done in this context may include sleep study and smell testing. And from a functional medicine standpoint, it's also a great time to evaluate gut health, inflammation, and detoxification pathways, something we do a lot in our clinic for many medical conditions. So in summary, Parkinson's is a slow, quiet condition before it becomes a loud one. The signs are there. We just need to learn how to see them. Understanding the role of the gut, the importance of the Lewy bodies, and the reality of these non-motor symptoms gives us a chance to intervene earlier and maybe even slow down the disease before it fully takes hold. And that's why focusing on your gut health while you're younger and healthier is never a waste of time. So today we only talked about one condition that largely stems and connected to the gut, but there's so many more. But that's a topic for another video. So if this video helped you, if it helped you to look at Parkinson's differently, please like, share, and subscribe because you never know who may need to hear this today. Thank you so much for watching. Until next time. Bye-bye.